Good morning. We're talking today about liposuction, various techniques, results, and appropriate candidates. Many people come in for consultation for liposuction for the purpose of having fat removed. There are some things that you can achieve with liposuction that you can't achieve with any other procedure, and these are important to note. Liposuction, however, will not make you lose weight really. The weight loss itself is minimal. Liposuction will tighten the skin only minimally, even with the laser lipo technique, smart lipo. So there's a limit to how much skin will actually tighten. Liposuction will not fix loose muscle or weak stomach muscles. So there's limits to liposuction, and liposuction alone will not cure cellulite. There are other techniques that probably will help it that we can discuss. But in terms of reducing volume in areas typical slight bulging or even significant bulging of the abdomen, thighs, the arms, back, liposuction has proven to be a very safe and very effective means of creating a significant loss of fat, and typically the skin will tighten significantly in almost all areas to improve the contour almost no matter what the circumstances are. So liposuction itself is a very effective technique, very safe when done in a proper setting, fully credentialed and fully properly organized operating room. We use standard 2-method liposuction, which is the infusion injection of a wetting solution which contains material and content that will stop the bleeding mostly and numb the skin, although we use anesthesia mostly with our surgeries. And then the standard technique of removal of fat is with these various size cannulas that are very thin and dynamic, with suction, little holes to remove the fat on the side. Very safe, and these can go through very small incisions and basically require one hand on the outside and one hand grasping the skin to sort of pinch the fat into the tip and basically break down the fat from the abdominal wall, let's say inch by inch or millimeter by millimeter, and create a very atraumatic, minimally traumatized tissue to cause the fat to be pulled away from the abdominal wall with minimal bleeding, and allow incision to remain very small and the recovery very quick. Some of the newer techniques, which include the water jet liposuction, which include the laser lipo, have come in. Ultrasonic liposuction has been around. All these other techniques have been tried, and there have not been truly any definite evidence that those techniques remove more fat, remove fat safer, remove fat better. There's certainly can be valuable tools, but they are simply tools in the hands of surgeons. Some of the misunderstandings are that if somebody goes in for laser lipo, they don't have to have anesthesia, whereas regular lipo does. That really is not true. The deeper you go with these cannulas, whether it's laser or standard cannula like that, the closer to the muscle you go, the more it's going to irritate the muscle. Usually, if you want to do a thorough job, get in there and work away at that tissue for a long time, you're going to need some kind of either sedation or general anesthesia, because I don't care how much local anesthesia, you get to a certain point when it's deep down in there, and the patients do have some sense even of pressure, and it's not necessarily comfortable, and I feel I can do a better job without having to worry about if the patient's hurting or irritated by the pressure sensation. So I prefer a little bit of anesthesia. We use just enough to make the patient comfortable, but the patient wakes up immediately, and there have not been any problems with either the anesthesia or the liposuction itself. We've had 100% perfect safety record over 17 years, having done thousands of these, which include liposuction, fat transfer liposuction with mini tuck, full tuck, etc., and lifting procedures. So the liposuction technique done in a qualified facility with an experienced surgeon is a very safe and very good technique. We can show you a few examples. That these include large cases, small cases, but the larger cases, when they say larger, we're talking about over probably 4 liters, should be done in an overnight stay facility, which we have done on occasion here, but typically we don't do overnight stays. Here's somebody that went from a large size to a small size in one surgery. She had large volume lipo. This was more than 5 liters, and she did stay overnight to receive the proper fluids and the proper care. But that can be dramatic change. You can still she still had some rolls of fat, but that was a big difference. Another lady that got a really good flattening and tightening and volume reduction. I show this to a lot of people because it gives people encouragement. You can see there's a good overhang here. She still got a little bulge, but the overhang is entirely gone. Now, we've seen many cases where the removal of fat, just the removal of fat and a little bit of roughing up of the skin from underneath will cause it to tighten up enough to create a loss or almost complete loss of the overhang, showing the sides really indented and taken in, make a big difference. Here's another one that got abdomen and inner thighs with a little gap creation there. So there's a number of applications here. Inner thighs. The bulging out is not completely corrected, but the bulging out is significantly corrected. I wouldn't call it completely flat, but if you look at small overhang plus a significant bulging out, that's a big improvement. So the which is standard liposuction alone, another patient with the same situation, a really big improvement, reduction of the bra roll, front, the sides, and the back, showing a major improvement in the form of the body with just liposuction. This is a male, actually creating some abs with contouring. Another male, a couple male cases, which sometimes are real. This is a guy that had some really big glove handles from the back. Still got a little bit, but the flattening is obvious here. This is the same guy from the front. You can see he actually gained some small definition, defining of his abdominal muscles. This is a really big guy, 6'5" plus, 290. And he got a lot of improvement there in his abdomen. Here's one that had real bad bowing out. But you can see the flattening. Same guy from the back. Little roll there, a lot of sticking out, and now he's not completely straight, but he's almost straight. So the power of liposuction, of course, is based on the technique of the surgeon, and whether it's any of these other laser lipo or smart lipo, it requires a lot of work, going deep, and usually it does require anesthesia. But here at Image Center, we do all ranges of liposuction and have had all happy patients regarding that, and basically a perfect safety record. Several questions that often come up about liposuction are will the fat come back? Will I lose weight? Again, weight loss is maybe a couple pounds depending on how much fat's removed. It's more of a size loss and volume loss. Return of fat, there's no immunity to fat gaining. There's no immunity to redeposition or accumulation of fat. Again, if you gain significant weight, you're going to gain weight in the same place that you were lipo. I've seen it takes a little more, meaning that it doesn't bulge out to the same extent, but there's no, meaning that people that have had lipo say, but I gained weight over the last year, and you can hardly tell. You could see a little bit of better definition than they had when they first came in, but there's nothing that stops it. all the fat can be removed, cannot be removed. The reason is that once you start to use these instruments a lot within a small, tight area, the fat, fat comes out. You better continue to bruise and beat up an area, and even the fat that's there starts to swell and get compressed against itself, and you get sort of a cavity, but in the walls of the cavity is the compressed fat, and it simply doesn't give itself up. And so really that's a point when we quit taking out fat. Like where do you stop? You stop when either there's a little bleeding, which is not safe, and frankly it's just trauma too much for the surgery, and or like I said, the fat stops coming out, and you kind of reach a point where you're not gaining anything by continuing to operate on that area with that technique. So that's the limiting factor. Some people, and many people actually, come in for repeat liposuctions, because what happens is you get out a lot, they like what they see, but they feel that there's still fat there, and you're always going to have fat there remaining, and they want a further reduction, and that's a very reasonable request. But we want to try to make people understand initially that you're not going to get all the fat taken out in one stroke or one procedure. So that's a big issue. Anybody interested, as long as they're a good candidate surgically and medically, we'd be happy to go over the details of the procedure. Thank you.